Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Current 5-day COVID-19 test positivity rate is 2.5%. 37 new cases of the virus have been identified today as of 9:30 a.m., bringing our total number of cases in Manitoba to 1,711. Today we are announcing a 19th death related to COVID-19. This is a female in her 90s in the Winnipeg Health Region. And this is linked to the outbreak at the Parkview Place Personal Care Home. So we extend our condolences to their family and loved ones. Today there is one case in Prairie Mountain Health Region, 4 cases in Interlake Eastern Region, 2 cases in Southern Health, and 30 cases in the Winnipeg Health Region. There are 449 active cases. 1,243 individuals have recovered. 11 people currently in hospital, with 6 of which are in intensive care. And the number of deaths due to COVID-19 is at 19. Our preliminary testing numbers show 1,616 tests were completed on Wednesday, bringing our total number of tests completed to 171,661. Manitobans are reminded to refer to the list of current testing sites and hours of operation before leaving home, and that can be found at manitoba.ca/COVID-19. We've advised Grant Park High School in Winnipeg of a confirmed case of COVID-19 in the school on September 15th and 16th and 17th. Based on public health investigations, the exposure was assessed to be low risk. This infection was not acquired at school. The Carberry Plains Health Centre has reopened and has moved from critical red to caution yellow on the pandemic response system. We continue to closely watch a number of indicators, especially in the Winnipeg Health Region, things like test positivity rate and demands on the healthcare system. We'll continue to follow these, and certainly public health, no public health interventions are off the table, and we're watching very closely. But we know of things we can do right now to decrease the transmission of this virus. Staying home when you're ill, even when mildly ill. Very important, and we've had a number of cases that unfortunately have not been able to follow that advice. We need to reduce the number of close contacts we have outside our home. That includes strangers as well as friends that we know, and just reducing the amount of people we're having close contact with. In the Winnipeg region, we're seeing an increased number of cases that are linked to bars, pubs, and restaurants. Many cases are young adults in their 20s. And have had many various exposures at restaurants and bars and throughout the city. We're providing a few examples to give people some insight onto some of the events that have taken place. So we've had a number of cases that have visited more than one bar in a single evening. And reports are that crowding and many people in attendance. We've had cases that have attended more than one bar in the evening while symptomatic, one of which had 36 contacts. So we see these type of issues. We know what to do about it. We know we should be decreasing our time in enclosed spaces, crowded places, and reducing prolonged contact. We certainly shouldn't be out and about when we're symptomatic. We've heard of sports teams paying close attention to physical distancing while in, say, the locker room and that type of activity, but then gather closely together soon after the event. And so again, this defeats the purpose of that physical distancing during the time. Our contact tracers have, you can see, quite busy with the number of contacts and number of new cases, but they are getting many instances of contacts being very angry, rude, and abusive when they're advised that they're contacts and advised to self-isolate. So again, getting back to we're all in this together. Certainly public health is trying to reduce the impact of this virus on the population. So it's certainly inconvenient to be named as a contact and to have to self-isolate, but we do it for a reason, to limit the spread of this virus. We know that even though there are a number of young individuals that are certainly acquiring the virus in the Winnipeg region, no one's risk is truly their own. These individuals will bring it back to home, to perhaps younger siblings, to older grandparents or older contacts, or people who are more high risk. So in a pandemic, when we say we're all in this together, there's no way to avoid that. No one can decide their own risk, because their risk belongs to others as well. So we need to continue to and get back on making more careful choices about who we spend time with and how we spend time with them. Certainly outdoors is more safe than indoors. Crowded, enclosed spaces, prolonged contact, those are the things we need to minimize. And certainly people will go out, and there are safe ways to do so, but we need to consider how to do it safely and to consider how to do it less often, especially in crowded events. If you're going to some place that is crowded and seems not to be following the guidance from public health, you should leave. And again, gets back right into those fundamentals. Staying home when sick sounds easy. We know that most of us have not done that in the past, and we see many people are not doing that now. So we really need to adhere to that. Staying home when ill. Washing your hands frequently, physical distancing. We can't be in crowded indoor places where we have numerous contacts. Wearing a mask indoor public places is something that's in addition. So again, remember, these fundamentals are always spoken together because they need to be practiced together. We are seeing anecdotal evidence of where people are wearing masks, then distancing is less adhered to. Because of that sense of protection from the mask, and it just can't be relied on in that manner. Certainly wearing masks in indoor public places is absolutely a good idea, but it can't be the only thing you adhere to. You still need to wash your hands, still need to keep that distancing, and you absolutely still need to stay home when you're ill. And staying home means exactly that: not going to work, not going to religious gatherings, not gathering with friends. These actions can sometimes take 2 weeks for us to find out their effects. And we always mention the importance of stigma, being kind, knowing that we're all in this together, knowing that our actions affect others and others' actions affect us. But we have to be very careful not to stigmatize groups because we really want everyone to feel safe to go get tested. And that's the best way for us to manage this pandemic. So thanks for that. Visit our website, manitoba.ca/COVID-19, and it can open up for questions.
Dr. Roussin, on the question, on the topic of bars and restaurants, are you able to say how many cases, like what's the most cases that have been traced back to one specific venue or event?
Yeah, so I don't, there's been numerous cases. I don't have specifics for any one event. What we found, though, and it's certainly not conclusive, but of the recent weeks, half of all new cases in Winnipeg have been at a restaurant, bar, or pub during the acquisition period. So it doesn't mean they necessarily acquired it there, but that's a staggeringly high number of people who were at these sites during their acquisition period.
We've heard from a lot of businesses that have their own mask mandates, and they say it would be, and they get some pushback, they say it would be a lot easier if there was that provincial mask mandate. What would you say to those folks?
Yeah, I think that, certainly the businesses are able to implement their own actions like this. But I mean, you hear it from me. I think masks in indoor public places are absolutely a good idea. As far as a mandate, we've always said nothing is off the table, and we're continuing to follow these indicators closely, and so that's something that we're still considering.
And we have had, as you're well aware, these testing capacity is up in the labs, but the sampling capacity still isn't there. Yes, Dynacare is adding one more next week, but from health systems, and I realize this is more a Siragusa thing than yourself, how did we get here? Like, when we knew we had added the lab capacity, how was it that we didn't have the swab capacity?
Yeah, well, I think certainly the capacity is, is there. It's just, remember, the demand fluctuates in different areas, right? And then so, like you said, we are working on increasing that capacity and doing so pretty quickly. So, I mean, it's absolutely important. We want to be able to have access to testing. We don't want large delays. We don't want people hesitant at all to go get tested, either because of stigma or because of long lines. So we definitely are working on it. It's definitely important with it. Along that same message also is asymptomatic testing. We want to ensure if there's a huge demand on our testing sites that demand is from symptomatic people. We don't want a lot of asymptomatic people lining up.
You mentioned large crowds. Should nuit blanche happen at all?
Well, the public health orders are in place, so everything that happens needs to follow those public health orders to a T. So when we talk about crowded places, enclosed places, prolonged contact, they have their capacity limits. So I can't speak specifically on any one event, but every event has to consider those public health orders. And also, as a Manitoban, everyone's got to consider, the trajectory of cases right now and make decisions that are best for Manitobans.
Are we going to see orange announcement on Monday?
We haven't made any decisions in that regard, but certainly nothing's off the table.
Prime Minister suggested that Thanksgiving gatherings are off the table. What's your message for Manitobans? Should we be canceling or not making plans for Thanksgiving?
Yeah, it's like along the lines I said, is that we have to start really reconsidering how we spend our time, who we spend the time with, and the amount of people. So enclosed places, crowded places, prolonged contact. So if you're planning a large family gathering, you're meeting kind of all three of those categories. So I would really consider not doing that. We're seeing this trajectory, truly in the wrong direction right now, and we have to take that step back and re-look at the way we're dealing with this virus.
So would there be like a limit on, if people were to gather, would there be a limit on family size gatherings, indoor or outdoor, or is it just completely off the table, do not gather?
Yeah, well, I mean, if we look at new orders, if that ever comes in, then we'll certainly have specifics on that. Whether it, say in the Prairie Mountain Health Order, it pertain to public gatherings, because that's what we were seeing at the time. But our orders could apply to any type of gathering.
As Chief Public Health Officer during a state of emergency, do you have that power to commandeer and marshal resources, all resources for sampling, for testing, and direct them to the public health needs of the province?
Not as far as as some individual method of commandeering that. Certainly there's recommendations that can be made. There's certain actions under the Public Health Act that can be taken. Many of them require still assent from elected officials. But certainly in this level of state, public health recommendations go far.
And what about that pharmacy testing? We're hearing Ontario's ready to roll that out. I don't know if the pharmacies are ready, but what are your thoughts on that here, and how could it work? When could it start if you're in favor of it? What do you think?
Yeah, we don't have specifics on that. We're getting information on that. We're going to see how that works. I think that looking at ways to increase our testing capacity is a good idea. And so whether that means pharmacies or not, it's early to tell right now. But we're certainly looking at many different opportunities to try to increase our testing levels.
Well, if industry is able to get testing for workers, why can't you say, okay, we're going to have testing for everybody? Industry, the private companies are going to have to start, focusing on public health, because they always say that's the thing. If public health is the priority, we'll prioritize those tests first.
Yeah, well, I mean, there's certain industries that have privately contracted companies to run their testing, for them. So none of our publicly available tests are available in that regard. So none of them are available for purchase. We deal with the public and prioritize, certain groups, but for the most part, it's all run through the public, and we certainly cover people who aren't covered by Manitoba Health because of the importance to public health. But for an industry, if that's what their arrangement is, then we'll certainly can provide advice on how to go about testing. Certainly, and in most industries, we don't recommend broad-based asymptomatic testing.
But you can't stop it or direct them to do something else.
No, if they were privately contracting with a company, that wouldn't be something that we would really look to stop.
When your contact tracers were met with abuse from people they advised to isolate, did they get followed up with a visit from a peace officer of any kind to drive home the point?
Not that I'm aware of. We contact cases and contacts daily to ensure they're self-isolating, to review symptoms, ensure things like that. If there is a suggestion there that they're not complying, then certainly we could send a public health officer to there.
Yeah, on the couple of the care home outbreaks, first of all, we've got Parkview now is more patients, more residents actually even than Bethesda. In the case of Bethesda, it was a Southern Health institution. This is a private institution. What does a province do in the case of a care home outbreak to ensure that they're doing everything they can to comply with the pandemic protocols?
Yeah, we work really closely with all of these long-term care facilities, have strict standards that they must apply. We have the one site rule as well. And then we provide that infection prevention and control assistance with it, and then certainly public health is there investigating the outbreak, recommending testing, and those such advice.
What's the total number of infected residents and staff at Parkview now, to your knowledge?
That is at Parkview. I believe is at. Let me just see if I have that listed here. Not sure if I have that listed. We'll get you that number. I believe it was at 8, one staff and 7. Okay.
What is the total number of people connected to the John Pritchard cluster now?
That's at 26 now connected. That doesn't mean everyone from the school could be contacts outside of the school.
Do we know the cause of that one yet?
We've done a fairly thorough outbreak investigation. We're going to be doing even more on that because we're quite interested in lessons learned, but we feel we have a fairly good understanding of the index and how transmission occurred.
Can you say how many active cases there are right now in personal care homes for staff and residents?
No, I don't have that in front of me.
And from CTV News National, public health officials across the United States and Canada are becoming targets with personal threats leveled against them, hate mail sent to their homes and offices. Why do you think public health experts are being targeted, and have you faced any threats or harassment during the pandemic?
Yeah, I mean, I think that in any important period, an emergency such as a pandemic, people are quite worried. And so, right from the beginning of this, I've received mostly supportive messages from Manitobans, but certainly negative comments on both sides, that there's too much restrictions or too little restrictions, that we should have masks, that we shouldn't have masks. And so I think it's just in light of a very challenging time, so people will feel the need to lash out in that regard and express their opinion as well. So I haven't had any threats. I've had some very well thought out insults sent my way, but for the most part, no threats.
Sure. And with Manitoba being in its second wave, how important is curbing it before flu season?
Yeah, we know there's always a strain on our healthcare system during respiratory virus season period. And so now, being the first combined season of COVID and flu, and as well as other respiratory virus seasons, we're not entirely sure what to expect. So we need to control what we can. We need to have a very robust uptake to our flu shot. We need to keep doing what we can do to limit the impacts of COVID, because we know this may be a very challenging time for our healthcare system.
Do you have any latest numbers on healthcare workers diagnosed with COVID for the province or for Winnipeg? Or
No, I don't have an update on that.
Doctor, just getting back to the care homes, I know you pretty much have told us everything you could about how you thought the infection got into Bethesda Place, but now that that investigation has continued, what did we learn from that? What to
Well, things we've learned, not necessarily specific to Bethesda, but in all these areas, is that we can't let our guards down. That we know there's a lot of people working hard, and we got through that first wave, and most of this wave still quite successfully, because of the hard work of those frontline workers. So we know that PPE is difficult to wear constantly, and so there is some lessons learned.
you've said that before in response to Bethesda, so are you confirming that we did see in the investigation that at Bethesda, the PP&D may not have been worn at all times?
Yeah, I can't confirm about Bethesda. I know like some of the challenges that were there is even just say lunchroom exposures between staff, where certainly masks wouldn't be on, but maybe not to the great distancing. Yeah, so I think it's just a few lessons learned, and for the most part, you can see that in many of the places where we had a single case or a few cases, they really stepped up and limited that, and we have many long-term care facilities with many workers in it, and they're doing a good job trying to keep it out.
What lessons have we learned from John Pritchard so far?
Oh, in that one there, I think there may not be a whole bunch that we can implement in that regard. We know that a single case in a classroom, we have to do thorough contact investigation. We know that sometimes in any outbreak scenario, the first case diagnosed by definition is often the index case, but may not be the actual index case on there. We know that young people can have very mild symptoms that sometimes can go unnoticed. So we're going to do a real thorough look still at John Pritchard, and we've been working with the school. School's been great and worked very closely with us, and we've had a couple debriefs with them already.
We've been told by students and parents here that in grade 7 classes were sharing the gym without masks at lunch hour and sharing surfaces like buttons to the bathroom. What can you say about that?
Well, I don't know any specifics there, but these are the type of things that we're hearing. And again, it's such a challenge, this virus is, because you can't let your guard down. And so we have those masks, have some of the spacing in the class. Everyone's working really hard, but it just takes something to slip through that could put people at risk.
In school, it appears that BC has reduced the list of symptoms that would require to send kids home. Are we looking at doing anything like that here?
We continue to review our screening guidelines, and that's where a real balance, right? And so it's the balance between finding every possible screening every possible symptomatic person versus having extreme levels of absenteeism. So we could have just runny nose on that list, because a certain proportion of our cases just have runny nose, although a small proportion. But if we all remember a typical respiratory virus season, there's lots of runny noses going around at that time, and if all those people have to stay home, that'll be a challenge as well. Other things we look at for there are people who are have a single contact named in their home. Does everyone have to self-isolate then if a single contact? That would probably be the safest thing, but if you think about the implications that would have on the amount of people requiring to self-isolate, it's very challenging. So we're continually running through that balance.
Thank you, Doctor. We're going to go to the phone now for a few questions. Up first from the Brandon Sun is Emily.
Hi there. My question is about the Carberry Plains Health Center. So I noticed that the cases were raised, and it was raised to level red on September 12th, or at least that's when it was announced to the public. And now it's been 12 days, and they're already back down to a level yellow. So this is less than one incubation period. So I'm wondering if you could provide more insight into how and why Carberry Plains Health Center was moved down to level yellow.
Yeah, and so this really has to do with the nature of the cases there. So there was a number of, there's cases and then contacts, and so there was the staffing issue, which was, also played a role into why we'd have to temporarily close that facility. And then we're not dealing with, ongoing transmission within the facility. And so we don't really need to wait for an incubation period. So if you look at, say, a personal care home or a long-term care facility or a ward on a hospital, if you have a case there, could have ongoing transmission within the facility. That's not really a concern here, so we didn't have to pay much attention to the actual incubation period.
Okay, thank you. And my second question, I'm wondering, a number of the new testing sites that are being set up in various communities across the province are drive-through testing sites. And so I'm wondering but not everybody has access to a vehicle nor lives within walking distance of a testing site. So I'm wondering what public health is advising for individuals that need to go for COVID-19 testing but don't have access to a vehicle, and can't walk there, and if they're symptomatic, obviously are trying to stay off of public transit. What's the solution?
Yeah, and so there is challenge, and so we're working on increasing our capacity in general to increase access, and then there's certain populations that we have to focus on increasing access to, and so we've done that with a number of, say, the homeless population. But this is another area that we're still working on, trying to find a way to have more outreach to certain populations to ensure everyone has access to testing when they need it.
From CJOB, Will.
Good afternoon, Doctor. This is Will from CGOB. We've seen a number of restaurants begin their own tactics for contact tracing, including keeping lists of customers' names and phone numbers. And as you say, many of these recent cases are tied to restaurants and bars. Restaurant Association also telling us they'd like to see the practice mandated across the province. So could you give us your response to that?
Yeah, I mean, it's something to certainly consider if we have names of people who are at establishment with times, and it's a little bit easier for public health to trace potential contacts with it. So again, I would consider that as an additional feature. What we need to do is ensure that the proper distancing is maintained, proper screening is maintained, and we really have to limit that close, prolonged contact. And so, table sizes, a number of people at a table from different households, we have to be careful about that. This is that prolonged and closed contact. So there's a number of things. That's a real good thought, and certainly will aid in public health's investigation.
Okay, thanks for that. Also wondering a little bit about saliva testing for the virus. People we've spoken to say it's safer, can be done a little bit easier than the current method. Is that something we could potentially see here?
We continue to look at any type of testing modality that's going to increase access and our capacity. So right now, saliva testing, for the most part, most of the the studies are showing that it's not as sensitive as a nasopharyngeal swab that we use right now. And from what I hear from lab professionals is at this point, working with saliva is a bit more difficult, so it's not as adept to mass numbers of testing done. And so that's just right now, right? Things change, new measures emerge, so we're continuing to look at that closely.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin, Scott Billick, Winnipeg Sun. What is the Winnipeg test positivity rate at the moment?
So it's, we do try to look at the test positivity rates in the regions. We don't report it because we're not confident that it's, absolutely reliable with it. But the test positivity rate right now is, that we have is slightly over 3 in Winnipeg.
Okay. Yeah, I guess to piggyback off that, I mean, the province has this pandemic response system in place to be used in areas that are concerning or whatever. You've said that Winnipeg is concerning. The trajectory is going in the wrong direction. Today you say that bars and restaurants and all that are 50% of the new cases over the last week, I guess. The whole point of this pandemic response system is to respond to, I assume, situations like this. Why is it not being used right now in Winnipeg?
Well, I mean, it's always being contemplated. So we definitely are contemplating an approach in Winnipeg. We can see that the test positivity is climbing. It has not reached where it was in, say, Prairie Mountain Health when we initiated the PRS change then. And certainly the overall rate hasn't reached what it was in Prairie Mountain Health when we initiated it. But it's absolutely something that we review daily. On what changes we need to do to the PRS. So we'll continue to do so and update Manitobans as we make those changes.
From the Canadian Press, Kelly.
A follow-up on that question, when you are seeing what would be a concerning trend of half the recent cases having visited bars, pubs, restaurants, what do you need to see as an indicator before you actually bring restrictions on these types of establishments?
Yeah, and so again, it's not just one thing that we look at. We look at a number of indicators. And trends, and so we do see the a lot of the trend in the indicators that we are watching going in the wrong direction. So we're going to continue watching that trend. We definitely watch the strain on the healthcare system, which we haven't yet seen in either of our waves. But of course, we want to get ahead of things like that. So we watch a number of indicators and those trends, and then we'll, when there just isn't a single trigger that makes us move, we'll be watching those daily and then update Manitobans.
And thank you for sharing a bit more about some of these examples where we're seeing these spreading events. When you hear about people who are going to bars and pubs and they're crowded and they're not going home or taking precautions, you're someone who's worked a lot over the last 6 months and you're probably in conversations with frontline healthcare workers. What message do you have for maybe these young people who are not taking the precautions they should be?
Well, I think we can all, understand how challenging this is. We've all been challenged, and so it's difficult to constantly adhere to public health recommendations, but we can see what happens when we don't, and we know young people they have much less severe outcomes, but again, no one's risk is truly their own. No one can just single-handedly decide that they're willing to accept a higher risk because you're not accepting that higher risk on your own behalf. You're accepting that higher risk on many Manitobans, anyone you're around, people at home, people you meet. So we truly are in this together. So really seeing these numbers where we're at in Winnipeg, I really going to rely on those young people to step up once again. Make a huge behavior change because we're moving in the wrong direction. But the good news is we know exactly what to do to reverse that because we've done it before. But now's that time again.
From City News, Mike.
Hi, Dr. Roussin. Mike Albanese from City News. So I know that when Prairie Mountain changed to orange level, obviously we saw a drop in the cases, and you say that Winnipeg and Prairie Mountain, the health regions, are different, and we haven't hit that threshold where we have to consider mandating masks. But with the variable of flu season approaching for Winnipeg, I mean, it's approaching for everywhere, but obviously our cases are happening now. Does that add a variable? Does that make you consider lowering that threshold at any point?
Relevant. We know we haven't seen really a spike yet in respiratory viruses, but we know that's coming. It comes every year. And that alone often puts strain on our healthcare system. So we know that a lot of the fundamentals that we've been practicing protect against those other viruses as well. We can see examples of that in the southern hemispheres where they've had lower flu activity than normal. But remember, they have that lower flu activity than normal because of the public health restrictions and activities of people. So absolutely, it's relevant, and we have to make sure we're going to be ahead of things, especially before we get hit by flu season.
And then one follow-up question here about Grant Park High School. I mean, as far as I'm understanding, no cohort was sent home because of this case, correct?
I don't think there was any cohort that had to leave. There may have been some close contacts who were identified, but not a entire cohort.
From CHVN, Taylor.
Hi, Dr. Roussin. Can I get you to explain that mobile collection site a little bit more?
Well, I don't have a whole bunch of details on that. I think that's something that will be in the works, and working with our partners, say at Dynacare, to be implementing that. So we'll, I'm sure there'll be more information on that coming over time.
And my follow-up is that presumably tomorrow will be the 200th COVID-19 bulletin. And when you sent out the first one, do you think, at that time, did you think we would still be dealing with this, let alone see all the changes to public health happen?
Yes, I think that we, had a pretty good idea that we're going to be in it for the long haul. Certainly couldn't predict, the nature of what we were be looking at, but I think most people in public health knew that, this is going to be a virus that's going to be circulating for some time. We may have thought that there might be more seasonality to it, like other coronaviruses, which we didn't really see with it here. But yeah, I certainly knew we were going to be in it for the long haul.
Thank you, Doctor. We now return to the floor for a few questions. Please proceed.
Doctor, I know we already talked about this, but when it comes to Thanksgiving, if you could just be maybe a little clearer, just kind of lay out the your guidelines for Manitobans and Thanksgiving.
Yeah, I think that we're back at that at that point where we have to pay a lot of attention to gatherings. And we know that close, prolonged contact and the more people involved and the longer time involved increases the risk of transmission of this virus. And so when we see the trajectory that we're seeing, especially in Winnipeg, this is really a time when people shouldn't be planning large family gatherings or any type of gatherings. And so we learned a lot from that challenging first wave, virtual meetings. We talked about social distancing, which should be really physical distancing, right? Keep in touch with people, check in on loved ones, make sure we're keeping in touch. But we really have to get back to that point where we shouldn't really be having 20 people over at our house right now. This is back to a real challenging time.
So if that's the case, and we have a pandemic response system, why not just say, let's make it 10, let's make it 6?
And those are the type of things we look at. That's what we did in Prairie Mountain Health. And so we're definitely looking at it right now in Winnipeg. We see these numbers. So we just haven't decided to implement that yet.
Haven't decided, so does that mean it's inevitable?
I wouldn't say, I don't like to use the term inevitable. I mean, it's the trend here has been going up for quite some time. If we look at it, it's unlikely to reverse unless Manitobans step up, which we know they have. So we're sending out that messaging now. So perhaps we can see a large change with the messaging. But if not, then we'll definitely have to act.
So what could happen in the next couple of days that would prevent that new restriction from coming?
Just in the next couple of days, it would be really just the case numbers, right? Like, so if we started seeing, much decreased case numbers, then certainly we would just be keeping a watch on it. We know that the case numbers tomorrow have nothing to do with what people listen today, right? It was what happened 10 or 14 days ago. So, So it's unlikely that we're going to see decreased case numbers in the short term.
If we know that half the cases are connected, not necessarily acquired at bars or restaurants, why not impose some restrictions right now, something temporary, something to try to get a handle on
So the
that?
pandemic response system does allow us to do that. It's certainly planned to do that. I think that what we want to do is get the message out to Manitobans. We want to speak to people in that sector and just say, you know, that, again, we know those sectors have been, you know, affected by COVID and all these restrictions we had, so it's challenging. But we want to get that message out that we have to make sure we're getting back to extra caution, or we may just have to use restrictions on it. But we just haven't made that determination yet.
Enforcement be targeting that area?
If we see the transmission events there, we want to make sure we're focused on areas where we're seeing transmission.
Do you have any idea how many people are self-isolating or are supposed to be self-isolating in the province? Hundreds, thousands?
Yeah, about probably close to about 1,000. I think last week when I had a report from the number of people self-isolating in Winnipeg, it was in and around the 700 mark.
Thanks, guys. Thanks very much.